If you wake up with a dry mouth every single morning, your body is screaming at you, and almost nobody tells you what that really means. The first thing you feel when you open your eyes is not energy, not readiness, not refreshment. It is your tongue stuck to the roof of your mouth, cracked lips, a throat so dry it feels like you swallowed a handful of dust while you slept. You grab some water, brush your teeth, and move on. You think it is normal. You think everyone feels this way, and then you make the biggest mistake possible. You ignore it. Today, I am going to tell you what nobody tells you about this symptom. Because in over 2 decades of medical practice, I have watched this silent signal be the very first warning of conditions that completely shocked my patients. Conditions that could have been caught so much earlier if they had just paid attention to this one seemingly harmless thing. Stay with me all the way to the end, because what I am about to share could genuinely change the course of your health. And if you have not subscribed to this channel yet, do that right now, because this kind of content can save lives. First, understand something fundamental. Your mouth is supposed to produce saliva constantly, even while you sleep. Saliva is not just water sitting in your mouth. It is one of the most underestimated and most powerful fluids in your entire body. It contains enzymes that begin breaking down food before it even reaches your stomach. It contains antibacterial compounds that protect your teeth and gums from infection. It stabilizes the pH balance in your mouth so harmful bacteria cannot take over. It lubricates your oral tissues and keeps them intact. When saliva production drops significantly during sleep, your mouth transforms into a hostile environment, a breeding ground for a cascade of problems that reach far beyond morning discomfort. But here is the central point I need you to understand. The dry mouth is not the problem itself. It is the messenger. It is your body saying out loud, "Something in here needs attention," and ignoring the messenger does not make the problem disappear. It only delays the diagnosis. The number one cause I investigate in any patient who reports this symptom is their breathing pattern during sleep. By far, it is the most common reason. If you are breathing through your mouth while you sleep, your mouth is going to dry out. That is just physics. Air flowing constantly over your oral tissues evaporates all available moisture. But the more important question is not what is happening. It is why. It could be chronic nasal congestion, allergies, a deviated septum, sinusitis, but it could also be something far more serious and far more dangerous: obstructive sleep apnea. And that diagnosis changes absolutely everything. In obstructive sleep apnea, the tissues at the back of your throat collapse during sleep and partially or completely block your airway. Your body, in a state of panic, tries to compensate by opening your mouth wider to pull in whatever oxygen it can. You snore loudly. You gasp or choke in the middle of the night. You wake up multiple times without any awareness that it happened. And in the morning, the result is always the same: a completely dry mouth, a throbbing headache, and an exhaustion that makes no sense after 8 hours in bed. And here is what should genuinely alarm you. Untreated sleep apnea is not simply a matter of feeling tired or disturbing the person sleeping next to you. It places a devastating strain on your cardiovascular system. Every time your airway closes and your oxygen drops, your heart has to work harder. Your blood pressure spikes. Your body releases a surge of stress hormones. Over time, this dramatically increases your risk of chronic hypertension, heart attack, stroke, cardiac arrhythmia, and even sudden death during sleep. I had a patient in his early 50s who came to see me for a completely unrelated reason. During the appointment, I asked about his sleep. He mentioned almost in passing that he always woke up with a dry mouth and that his wife complained about his snoring. I ordered a sleep study. The results were alarming. His blood oxygen levels were dropping to dangerous levels dozens of times per hour, every single night, without him ever knowing. He thought he was a good sleeper. He thought the dry mouth was just because he did not drink enough water before bed. That conversation, that one seemingly insignificant detail, likely saved his life. We caught it before a serious cardiovascular event could occur. The second cause that nobody wants to hear, but that I have a responsibility to mention, is diabetes. When blood sugar is chronically elevated, the kidneys go into overdrive trying to eliminate that excess glucose through urine. The result is that you urinate in greater volume and more frequently, a process called polyuria. And when you lose more fluid, you become dehydrated. And one of the earliest and most noticeable signs of that dehydration is a dry mouth, especially when you wake up. Now pay close attention to this combination of symptoms. If, beyond the dry mouth, you are also waking up to use the bathroom multiple times during the night, feeling excessive and constant thirst throughout the day, experiencing fatigue that does not match your level of activity, having episodes of blurry vision, or noticing tingling or numbness in your hands and feet, these signs together form a picture that cannot be ignored for even one more day. Type 2 diabetes does not appear overnight. It develops slowly and silently over months or years. Many people carry elevated blood sugar without knowing it, without feeling anything dramatic, without a clear turning point. The dry mouth may be exactly the first signal your body is sending you, and if you catch it at that stage, the changes you can make in your diet, your lifestyle, with proper medical guidance, can completely reverse the trajectory and prevent devastating complications like kidney failure, nerve damage, vision loss, and wound healing problems that can cost you limbs or your life. The third cause affects an enormous number of people and is almost never considered: medication side effects. If you take any kind of medication, whether for blood pressure, depression, anxiety, allergies, pain, or any other condition, there is a very high probability that dry mouth is listed as a side effect. Antihistamines used for allergies are among the worst offenders. Antidepressants, particularly those in the SSRI and tricyclic categories, cause significant oral dryness. Blood pressure medications, especially diuretics, dehydrate the body and reduce saliva production. Pain medications, muscle relaxants, anti-anxiety drugs. The list is long and surprising. I am not telling you to stop taking your medications. That would be irresponsible and potentially dangerous. What I am telling you is that if you started a medication and noticed your dry mouth got worse, you need to bring that to your doctor. Very often there is an equally effective alternative that does not carry this side effect as strongly. Sometimes a simple switch resolves the problem entirely. And why does this matter so much? Because when the mouth stays chronically dry for months or years, the entire bacterial balance of the oral cavity shifts. The beneficial bacteria that thrive in a moist, well-balanced environment begin to die off. The harmful bacteria that cause cavities, periodontal disease, and infections take over. I have treated patients who had perfect dental health their entire lives and suddenly, in their 50s, developed rampant cavities and severe gum disease. When we traced it back, the common denominator was always chronic dry mouth caused by a medication that had been started around that time. And gum disease is not a problem confined to your mouth. The science linking periodontitis to heart disease is increasingly solid. The connection between gum inflammation and the progression of Alzheimer's disease is real. The relationship between compromised oral health and worsening diabetes is well established. A chain of dominoes starts falling from something that seemed too small to deserve attention. The fourth cause is chronic dehydration. And I know you might think that is obvious, but listen carefully because it is more nuanced than it appears. Most people believe they drink enough water. The reality is that a huge percentage of the population lives in a state of mild, chronic dehydration without realizing it. Coffee and tea are diuretics. Alcohol is a powerful diuretic. A diet high in sodium and ultra-processed foods forces the body to need significantly more water to function properly. If you exercise and do not efficiently replace the fluids lost through sweat, you are going to bed already dehydrated. If you sleep with the heater or air conditioner running in a low humidity environment, moisture is literally being pulled out of your body while you sleep. Add all of that up, and you have a person who wakes up with a dry mouth every single day and never understood why. The solution is not simply drinking more water. It is building a hydration habit distributed throughout the entire day. A practical reference: aim for at least 35 milliliters of water per kilogram of body weight daily. Reduce caffeine and alcohol, especially in the afternoon and evening, and seriously consider placing a humidifier in your bedroom. Keeping the relative humidity between 40 and 60% can completely transform your sleep quality and eliminate morning dry mouth entirely. The fifth cause is one that many doctors are still slow to investigate: Sjogren's syndrome. It is an autoimmune disease in which the immune system attacks the very glands responsible for moisture production in the body, primarily the salivary and tear glands. The result is persistent dry mouth, dry and irritated eyes, intense fatigue, and joint pain that appears and disappears without a clear pattern. It is more common in women and tends to present after age 40, though it can occur at any age. The problem is that many people go years without a diagnosis, attributing the dry mouth to aging, the dry eyes to excessive screen time, and the fatigue to everyday stress. If your dry mouth is persistent, does not improve even when you are well hydrated, and you also deal with chronically dry eyes, unexplained exhaustion, and pain that comes and goes without reason, ask your doctor specifically about being evaluated for Sjogren's. Early diagnosis fundamentally changes your quality of life and prevents serious complications, including a slightly elevated risk of lymphoma in untreated cases. There is one more factor that rarely comes up in these conversations, and that I consider increasingly important in my clinical practice: the role of chronic stress and anxiety in dry mouth. When you are in a constant state of alert, the sympathetic nervous system, that primitive fight-or-flight mechanism, stays activated. The body, interpreting that you are in danger, redirects resources toward muscles and vital organs, and reduces flow to functions it considers secondary in that moment, including digestion and, yes, saliva production. If you are someone who goes to bed with your mind racing, thoughts looping, worries unresolved, it is entirely possible that this system remains partially activated throughout the entire night. Reduced saliva, shallow breathing, tendency to breathe through the mouth, and in the morning, dry mouth, tension in the body, the feeling that real rest never happened. Chronic stress is not a minor inconvenience. It permanently elevates cortisol, promotes abdominal fat accumulation, compromises immunity, degrades the quality of deep sleep, and accelerates cellular aging. The dry mouth is just one of the visible signs of an internal state that is crying out for help. There is also the connection between acid reflux, known as GERD, and dry mouth, which very few people make. When stomach acid travels up through the esophagus into the throat and mouth during sleep, the body can react in different ways. In some cases, it reduces saliva production. In others, the acid itself damages the oral tissues and creates a persistent sensation of dryness and burning. If you wake up with a sour taste in your mouth, a burning sensation in your throat, a chronic cough, especially at night, or the feeling of something stuck in your throat, reflux may be directly contributing to your problem. Not eating within 3 hours of bedtime, slightly elevating the head of your bed, avoiding acidic foods, coffee, chocolate, and alcohol in the evening, and maintaining a healthy weight are all measures that help significantly. And if those are not enough, there are highly effective medical treatments available. I also want to address aging honestly because it deserves to be discussed directly. As the years pass, salivary gland function naturally declines somewhat. That is real, but that natural decline on its own should not cause intense dry mouth. When the dryness is significant, there is almost always an additional contributing factor, whether a medication, an undiagnosed medical condition, or a lifestyle habit that is making things worse. Do not accept chronic dry mouth as something inevitable that comes with getting older. Almost always, there is something that can be done to improve it. Now, the complete action plan. If you suspect sleep apnea, Schedule a sleep study as soon as possible. Do not put it off. Today, there are home sleep study options that are highly accessible and convenient. If apnea is confirmed, treatment can be life-changing. Patients who begin proper therapy report feeling genuinely awake for the first time in years. Energy restored, mood improved, blood pressure normalized, and dry mouth gone. Hydrate intelligently throughout the entire day. Drinking liters of water at 10 at night will not help and will only have you up urinating all night. Distribute your intake across all your waking hours. Reduce caffeine and alcohol, especially in the afternoon and evening. Place a humidifier in your bedroom and monitor the humidity level. Review your medications with your doctor and pharmacist. Bring a complete list of everything you take, including supplements and over-the-counter products. Ask directly whether any of them could be causing dry mouth and whether alternatives exist. Train yourself to breathe through your nose during sleep. There are nasal strips, internal dilators, and other tools designed specifically to help with this. For many people, this single change resolves the problem completely. Take care of your oral health with extra diligence. Brush at least twice a day with fluoride toothpaste. Floss daily. Choose an alcohol-free mouthwash because alcohol-based rinses will make your dry mouth worse. Consider oral moisturizing gels for use at night. And see your dentist every 6 months without exception. Get your blood sugar tested. If you are over 40, overweight, have a family history of diabetes, or have any of the symptoms I described, do not wait for a crisis. A fasting glucose test and a hemoglobin A1C are simple, affordable, and can completely change the direction of your health. And treat stress for what it truly is, a medical problem that deserves serious intervention. A relaxation routine before bed, deep breathing, meditation, walking, therapy, an honest reassessment of your priorities and your limits. None of this is optional when your nervous system is in a state of chronic collapse. Before I close, I want to leave you with the most important thought in this entire video. Your body is extraordinarily intelligent. It monitors every function, every parameter, every imbalance, constantly without stopping. And when something is wrong, it sends you signals. Some are loud and impossible to ignore. Others are quiet whispers like a dry mouth every morning that most people dismiss without a second thought. The people who live the longest, who age with more health and more quality of life, are the ones who learned to hear those whispers before they had to become screams. They are the ones who do not dismiss symptoms as normal just because they are common. They are the ones who investigate, ask questions, and take action. If you wake up every morning with a dry mouth and you have never taken it seriously, today is the day to change that. It might be something simple to fix, but it might also be the first thread of something that, pulled at the right moment, saves your life. If this video made sense to you, if it opened your eyes to something you were brushing off, I need one simple favor. Share it with someone you care about. A family member, a friend, someone you know has this symptom and never thought twice about it. You might be helping that person catch something early that makes all the difference. And subscribe to this channel right now and hit the notification bell. Every single week I bring content like this, direct and without filler, with the information you need to truly understand what is happening inside your own body and make smarter decisions for your health. That is my commitment to you. Take care of yourself. Listen to what your body is trying to tell you. I will see you in the next video.